Post 40 is indeed a very challenging time for most women, especially because this is the time where women are aging and a lot of hormonal fluctuations are happening in their bodies, which cause innumerable symptoms. The following are some very common symptoms like mental anxiety, depression, a lot of sweating. A lot of women complain of burning in the feet, bloating, excessive gas formation, skin problems, hair problems, inability to sleep. That's a very, very common symptom. Also associated are various lifestyle diseases like hypertension, like blood sugar, like thyroid, like fatty liver. So these are all the very common symptoms which women over the ages of 40 are facing. And now let's see what should be the important investigations and how we should proceed. One most important thing is that every woman over the age of 40 should go in for an annual physical examination to a good physician. The physician will look into your blood pressure, will monitor your heart rate, would monitor your weight. You can also go in for a gynecological investigations where you will be, your breast examination will take place. Sometimes even your pelvic examinations may be also there. Then we come to the important investigations. The physical investigations may be something like ultrasounds, like cardiac checkups, like a TMT test, an echocardiography, and if needed, even a cardiac calcium scoring done on CT. We can also go in for an eye investigation, a dental checkup, and if needed, a transvaginal sonography for your pelvic organs. The pathological investigations will include a complete blood count, where we can see also the hemoglobin, the ESR, vitamin B12 and vitamin D. These two micronutrients are found to be very much deficient in women over the ages of 40. So please be careful about your vitamin D levels, about vitamin B12 levels. Also the lipid profile, the LFT, the thyroid function test, blood sugar, HbA1c. All of these are few very, very important investigations. Now we come to nutrition. What exactly should a woman over the ages of 40 have? So please be very careful that include good quality protein in your diet. With protein, I mean in non-vegetarians, of course, you can have your whole eggs and you can have your non-veg. In the vegetarian population, please go ahead with including a lot of curd, which is also a good source of probiotics, and also stuff like paneer, which will give you good quality protein. You can include complex carbohydrates in the form of lentils, in the form of legumes, all the dal, chola, chana. They act as a good source of carbohydrates as well as some amount of plant protein. Please remember to steer clear of all refined oils and come back to the ancient ancestral way of eating your traditional ghee, coconut oil, or if needed, extra virgin olive oil. Now, the most important thing for the women over the ages of 40 to be very careful about is you should not lead a sedentary lifestyle. Include movement, walk as much as possible. Please remember, sitting is really, really lethal for all of you. For those who really want to move into fitness, who want to lead a very healthy, productive life, you can move into yoga, do very good quality yoga. Pranayam is extremely good for your health, and you can also focus on strength training, body weight training, or join a good quality gym and move into weight training. So well, it's not a scary age after all. Ages above the 40 can actually be extremely productive, can be extremely beneficial, and you can lead a very happy and healthy life. But just remember, this is the time when you have to be extra careful and extra focused on your health. And then it's all a good life from there on.